My name is Dr. Drew Sinatra. I'm a naturopathic doctor, and I practice at the Clear Center of Health in Mill Valley, California. We treat a lot of Lyme disease here, and we're not really big into the antibiotics. We kind of get a lot of people that have been through antibiotics for 2-3 years at a time, and it hasn't worked for them. So we're trying our best to use herbal medicines and working on detoxification and immune support and any ways we can really support that person through the infection and to help clear the Lyme and other co-infections that may be there. One of my most inspiring cases for treating Lyme disease was I think she was around 17, and she'd been bit a year before by a tick. She went into the hospital. This is in Marin here, up in Nevada, and the doctors said that Lyme disease doesn't exist in Marin County. So they refused her antibiotics. Even though she had a tick bite, had the bullseye rash, they said it doesn't exist here, so we're not going to treat you. So she went untreated, and 3 or 4 months later, she started to exhibit symptoms like really intense debilitating fatigue. She was having joint pain, she was having digestive issues, she was feeling dizzy, she was having vertigo. Her whole health had kind of just gone downhill really quickly. And so she came in here very desperate. She wasn't even going to school anymore. And so I did some lab testing, and I found out that she did in fact have a Lyme infection and some co-infection as well, which is called Babesia. And I treated that using herbal medicines. We used IV therapy. We did some detoxification protocols. I really supported her gut with certain dietary changes. And within 9 months, she was pretty much back to normal. So that was a case that I just really felt good about because she was struggling so much. And we did simple things for her, right? It's like simple things, working on her diet, her sleep, encouraging exercise, and of course using some natural therapies to kind of help her get better along the way. I think that a lot of people are exposed to Lyme, but generally, if you're in good health, your immune system can take care of it. There's a lot of people walking around with Lyme disease, but they're not symptomatic. So they're not showing any signs, right? And I think what happens is we're living in a society that is incredibly toxic. There is, foods that we're consuming that aren't good for us, right? That we think are good for us, but we're consuming lots of sugar and carbohydrates and bad fats and such. And so we also live a very modern life where it's full of stress. So what happens is it's like a perfect storm. So if someone gets infected with Lyme, and if their immune system is so suppressed, due to some of those factors that I mentioned, then they're more susceptible to getting symptomatic or becoming symptomatic with Lyme. And then it can become a problem for them. So I do believe that in general, our immune system can fight off Lyme, and the organism is called Borrelia burgdorferi. It can fight it off, but if you're fighting another illness, if you're exposed to toxins in the environment, you're under a lot of stress, then you're going to be more susceptible to becoming symptomatic. Western medicine doesn't usually recognize Lyme disease for many reasons. One, it's really the testing that is so limiting, because the testing that we have and we offer to people, at least conventionally, is very limited. It's not sensitive enough really to pick up an infection, because essentially it's measuring the body's immune system's response to having Lyme in the body. So it picks up on different antibodies, right? But one of the roles of Lyme is to suppress your immune system. So you suppress the production of antibodies, and therefore you can't test for positive if your immune system isn't even reacting in the first place, or it's suppressed by Lyme disease. So number one, testing is very inefficient, and it's not very helpful for picking up a Lyme infection. And then secondly, doctors just don't recognize it. Well, I always try to rule out other illnesses or other conditions, because the last thing that we want to do is really treat Lyme when Lyme isn't even a problem for someone. So they could even come up positive on a test, but like I said, people can have Lyme disease, but they may not be symptomatic. For Lyme treatment, sometimes we recommend IVs. And these IVs may be nutrient IVs that contain vitamins and minerals. We may recommend an IV that is ozone, so O3 that we put in there. It might be UVB. We also do the PK protocol, which is really infusing phospholipids into someone. So there's lots of different forms of IVs that we do. We have a Hocket here, which is really a hyperthermia machine that also infuses ozone through the skin into someone, and it has pulsed electromagnetic frequency, which is PEMF. So that's kind of like an all-inclusive, detox supportive treatment for someone, and we find that is really helpful for Lyme as well.